welcome everybody. Thank you for joining us. We are all working from home. We have been for a week now during this time of social distancing and trying to get used to it. Most of us are webinar newbies, so I hope you have some patience with us. It's been an interesting experience. As Eide Bailly, we do want you to know how much we love working with you, especially our medical and dental professionals. That's where we represent our healthcare team at Eide Bailly. And we want to be a help and a resource to you at this time. And we especially want to thank the medical professionals who have joined us for your service to the community. Please be safe and stay healthy. So I want to introduce your panelists. First of all, I'm Eric Nuttall. I'm one of our healthcare team partners, and I'll be going first and speaking about cash flow and patient cancellations and just the different ideas we've had as we've spoken to our various clinics. Then Debbie Hayes will be our next presenter. She's one of our healthcare consultants. She's going to be talking about HR and our various HR strategies and compliance. Shauna Schaefer is the head of our healthcare medical practice division, and she'll be talking about different tax laws that have been passed. The House just came out of a meeting. They've got some ideas. We'll get some guidance on possibly where some of this is going. And then lastly, Jackie Colt, one of our practice management healthcare consultants, will be talking about revenue cycle, telemedicine, and billing telemedicine visits. So we'll get started with cash flow and cash flow planning. And we wanted to start with this because, frankly, we don't know how long this is going to last. Right now, the feds are scrambling, trying to come up with different options, different solutions, different helps, and we just don't know where this is going to go. We are very concerned on helping you navigate this difficult time and honestly be able to keep yourselves in business as long as we can. As we've spoken to you this last week, our clinics seem to be on a range. We have our dentists and some of our other medical specialties that are just plain and simple shut down, emergencies only. And then our primary care seem to be bumping around 50 to 60% patient load. So everybody's at reduced patient volume, if any patient volume. And helping you be able to come back out of this when that day that we all hope and know has to arrive gets here is our top goal, and giving you tools and ideas to help you get there.
So Eric, this is Shauna. So I've been hearing the same thing from our clients, that they are nervous, that they don't know what's going on, that this is unprecedented times. So there's a balance between the practices that are still seeing patients, the practices that can't see any patients. What are you telling people to do right now?
Well, right now, I am trying to help my clinics save cash, stop cash outflows as quickly and to the greatest extent possible, simply because we're in a time of unknown. We don't know how many weeks or months of payroll you may have to meet. And so we're focusing on different tax payment issues, trying to pay. We realize we're dealing with all self-employeds here. So how do we help you maybe hold on to some of those tax dollars as a way to maybe float yourselves, your families, and your clinics? Retirement, employees, we're trying to focus on all those angles. First and foremost, I think the big thing that we're wanting to talk about is just the other major cash flow outflows that everybody's facing. Call your supply vendors, call your student loan providers if you're still having student loans, your mortgage providers, landlords, ask for a payment holiday. We're hearing great feedback on that. Nobody wants a repeat of 2008, and everybody's being pretty open at getting forbearance. So make those phone calls first and foremost. Let's stop some of those cash outlays. A lot of you still have 2019 retirement that's not funded. In fact, I got some retirement testing reports just this morning, and we're looking at that just before this webinar. What's our choice? And first and foremost, we're not going to fund until 9/15, which at this moment is the extended date. We're going to hold on to that cash. We may have to redo the return and not take a retirement plan deduction and use that cash. We're just trying to keep our options open right now in this time of uncertainty. As you get your taxes completed, we do recommend you do finish and get your taxes done. If you owe, as of today, you don't have to pay anything until 7/15. There's a very good chance that will actually be extended to 10/15. Same thing on 2020 taxes. If you pay estimated payments, don't hold on to them, save them. They're not due until 7/15 as of right now.
And Eric, we're going to address this later in the presentation, but the tax payments that you're talking about right now, I just want to clarify, those are income tax payments. Currently, there are no holidays that Congress has approved or that the IRS has approved for employment tax payments. And interest and penalties on those payments tend to be large and severe. And so make sure that you are making those payments timely. Use right now the tools that we have been given in the income tax payment department to defer those payments, but you do need to go ahead and make those unemployment payments on time until Congress gives us other guidance.
Thank you. Thank you for clarifying, Shauna. We're all in income tax preparation mode, so that's where all of our minds go to, but I appreciate that,
Sure.
that broader perspective. That's important. Another issue that has came up both this morning but also yesterday is anybody who has a cash balance plan. In order to reduce those commitments, a couple things have to happen. First of all, there needs to be some major business event. Well, we're having the most major business event of any of our lifetimes. So that box is checked. But the second is you have to amend your plan during the calendar year. So for 2020, if you may want to skip payments for 2020 or contributions to a cash balance plan, you need to make that amendment this year. You don't have to make it today, but this calendar year. And I'm talking to quite a few clinics that, again, in the mindset of conserving cash, are saying, hey, let's hold back some of our retirement right now until we know where things are landing, because there's just too many unknowns. We want to point out that the SBA has a disaster relief loan available. It is being overwhelmed on sba.gov. Some of your clinics and dental practices are shut down. I guess hitting the refresh button on that site might be your new task. We do recommend that you get those loans applied for. They're up to $2 million. The repayment is over 30 years. They're pretty flexible.
And Eric, I'm actually going to interject again. One of our participants had asked if the disaster relief payments apply in a situation like this. And so currently there are many, many locations throughout the US that are considered disaster areas. That has triggered a lot of the SBA disaster relief because that funding came from the federal government. I believe that was actually one of the first bills to pass in early March. Some of the other disaster relief that could be available could come either from states or for the federal government as well, but we do have to wait for funding for that relief to happen in order for that to go to some of the people who are being affected. We're going to talk a little bit later about some of the items that are in Congress at this time, and there is a big difference between the bill being proposed by the Republicans and the Democrats, but there are varying degrees of relief in those bills. So we'll discuss that in a little bit. Thanks, Eric, for letting me interject there.
Oh, thank you, Shauna. And so these are all things that we can change right now that are pretty easy, that don't really hurt anything. And that's why we recommend them first. The next item to go over lightly, because it's really up to each of you what you do here, but it's your biggest cost, and that is staffing. I'm sure if you have gone into the clinic this week, you have been overstaffed. Like I said, we're hearing anywhere between 0 patient load to about 50, 60%. and of course, many of you, especially our dentists and some of our specialty clinics, are just plain shut down except for emergencies, and varying degrees of how many emergencies. So being strategic about your staffing, which is probably polite speak for, do we need to be cutting back and making those hard decisions? And as I've talked to my clinics, it varies between we want to carry them no matter what, to we've already made decisions on who we let go first and when and how. And the concern that we have as we've talked about this is that today you all still have a backlog of collections, accounts receivable, that is going to be still hitting your bank accounts over the next 30, 60 days. But whenever this ends, let's say it ends 15 days from now or 7 days from now, like they hope to only shut down for 2 weeks, you're going to need to staff back up and start seeing patients, probably a large backload of patients at full capacity or even greater than full capacity, and the collections by then will have dried up. And that's why we're so focused on conserving cash and making some decisions with respect to our staffing now to conserve cash can really pay off in the long run. And Debbie Hayes is going to spend quite a bit of time on what that decision-making process might look like, as long as in addition to the new tax act that has passed, Family First Coronavirus Recovery Act, that Sean is going to go over.
And so just a couple of more questions from our attendees. People are asking more about the SBA loans, and a couple of things to note. I think Erin mentioned this, and I'll echo this as well. The SBA site is very, very busy right now. So as I would tell my children, put your patient pants on, because it is going to take a while to navigate through that site. Just like everything else, the capacity there is quite overloaded. Some of the other questions: do we have to use our line of credit before we apply for that SBA loan? Right now, I don't think this is a line of credit or SBA loan type of situation. I think we need to put the word "and" in there. You need to be making sure that your line of credit facilities are maximized as much as possible. Call your banker, make sure that you have extend that line of credit if you possibly can, and apply for the SBA loan. So I think in this particular situation, because there are so many unknowns, it needs to be an "and" situation. The final question here was any ideas of fees for these loans? I don't have any ideas. I'll throw that out to the other presenters. Any other ideas or any other follow-up to this line of credit, SBA loan type of situation? Can you guys speak on that?
SBA interest rates are generally between 2.75% and 3.75%.
And what about,
they're reducing it for the disaster loans, so it's probably the 2.75.
And what about fees, Debbie? Have you had any experience with the fees for those yet?
Okay. I don't have those.
And I'm guessing that probably would vary between which actual bank you get your loan through. So make sure you're shopping around and pushing that through.
Okay.
So the next thing we want to cover is patient visits, cancellations, and then what do we do when this does in fact recover? And just, this is more a compilation of ideas I heard, and as we heard the panelists as we've talked to our various clinics in dental practice. We're not trying to say that there's any one solution. It's more just to give you as many tools and ideas as possible that you might be able to adjust. I know many of you have already made a lot of these decisions, but you might want to make some adjustments based on what we share. Communication is the biggest thing we're hearing. The news is not helping. People are panicked. So getting calming messages out from your physicians, from your dentists, what you're doing for patient safety on the patient visits that you're able to still have, how you're going to accommodate that. Do it by email, do it by videos on your website if you can, links on the emails back to those videos. The more you can communicate, the better result we've heard you're going to be having on being able to maintain as many patient visits as possible right now. Also, emailing instructions, what to do. Many of you have adjusted your protocols and it's not just come into the office. And also, now may be the time to light up a text-based solution such as Solutions Reach. People don't email much in their lives anymore, and so sometimes we might need to adjust the way they communicate.
And I'll just echo that even more. Jackie's going to be speaking a little bit later about some ways that we can potentially get some cash into your clinic right now, even if you're not able to go into the office. Your patients need you right now. Your patients need you because their allergies are acting up, because they have an ear infection, because they have a toothache, because maybe they're out of contact. So your patients still need you, and it's up to you to communicate to them how they're going to access your services in this new time. And so Jackie's going to be talking about ways that you actually can see those patients and get paid for seeing those patients, which is of course the most important part. But I think even just to emphasize Eric's point even more, with so many unknowns right now, unless you give them the way that they're coming to access your care, they're probably going to make assumptions and potentially access care somewhere else. And so if you are still there for them and you are still able to provide services to them through some other method that is different than coming into the office, you need to make sure that your patients know how that's going to work.
And I think my understanding is you're going to get these slides. You may actually already have them in your email. So I'm not going to go through all the different ideas we've heard on protocol examples, but it does all fall back to communication, and just what Shauna said is giving them clear instructions on how to access your care, having good messaging. I've heard over and over again from my wife, who works in a pediatric office, that as the front desk is calmly going through their patient safety protocols, frantic moms who wanted to cancel are then agreeing to come in and have their well child visit, which most of the pediatric offices are wanting to continue for various reasons. So good communication, good safety protocols, and communicating those protocols. And the big thing here is, there we go. The big thing is to try to avoid canceling. Try everything you can to reschedule. Where Jackie's going to go over telehealth visits, offer a telehealth. We're hearing clinics who are proactively offering telehealth in advance of the visit. Reschedule, don't cancel. And we know that we don't know when this is going to end. Pick a time frame and reschedule anyway, even if you have to reschedule again. We don't want you leaking patients. That's what we're trying to avoid here. And keep a patient recall list for those who insist on canceling. And just the best we can tell you is get it set in your mind that if and when there is no if, when this comes back, you're going to have a full day, because their patient visits, there's going to be a huge backlog, and you're going to want to service that backlog of patients and see those patients so that they don't go elsewhere, because everybody's putting off stuff both on the patient and on the physician side because of the different guidelines we've been given.
And to interject again, if you're a specialist and you rely on referrals from primary care physicians, I would recommend you reach out to those referral sources right now. Let them know if you're able to see patients right now, that's great. Let those referring physicians know how you are seeing those patients right now. If you're in a state like Colorado where any sort of non-emergency visit isn't allowed currently, let them know that you are still scheduling those patients into the future and you are still interested in seeing those patients. And so again, I think as we're serving our patients and as we're providing not only for the physical health of our patients, but the mental health of our patients, knowing that the care providers are still taking their diagnoses seriously, they're still caring about their patients, they're still actually putting them on the books, I think is really going to mean a lot to those patient populations as well. And so you may not be able to see them today, but putting something on the books and knowing that you will see them in the future, even for referring providers, I think is important. So reach out to your referring providers, reach out to your patients, make sure that they know that they can be seen, if not today, in the future.
And then, as I mentioned, your biggest cost are your people, and what can and should we be doing? And Debbie, we'll turn it over to her to go over HR strategies and compliance.
Thank you, Eric. I'm so glad you all joined us. Really appreciate that. Eric was talking about some HR strategies. Uh-oh.
Click resume slideshow. Here, let me get it.
There we go. For HR, and so many of you may have already been doing this, but one of the things is probably do an employee questionnaire. Find out who and when your employees might be absent, whether they're going to need to be off for school and daycare, although most of that's already happened if they had to. If they would need to be able to care for others if services were unavailable. If they would be unable to get to work if public transportation was unavailable. And then finally, if they're high risk due to being older than 65 or having compromised immune systems, et cetera, and what that might look like. So for those who are needing to keep a workforce together and losing some of that would be difficult, those are important things to plan around. And also for potential layoffs or whatever else you will do with your staff. So some of the tips, some of the things you can do as you're looking at reorganizing work schedules and roles is obviously if you can find a way to do telework, that's the best of all worlds. There's some things that go into that. Not everybody is able to do that, but that's one thing you can do. Another possibility, especially if you're implementing telehealth with your patients, is you may not need to have everyone in the office at the same time because you don't have as full a schedule. So you might be able to rotate staff on certain days. And some staff can do visits at home on telehealth while others are in the office seeing patients, and you might be able to be more efficient that way. Another thing to think about is unemployment versus layoffs or leave. Currently, if you lay off an employee, they have the ability to be covered by unemployment insurance. And that's not the best of the situation for the employee, but it is definitely a good option because that is a longer term solution. If you do temporary leaves or invoke one of the legislations that we're going to talk about in a minute, through this, two things happen. One, you're paying for the payroll when you're doing those versus the unemployment office, and the benefits don't last as long for the employee. So there's some things you want to look at there when you're taking that into account.
Sorry to interrupt,
Yeah.
Debbie. Would it be fair to say as well, if you are trying to pay the employee at a reduced schedule, or maybe even using one of the new leave acts, could it potentially be less than the pay that they would get if they went to the unemployment rolls?
Well, different unemployment offices are a little bit different about their percentages, but I lost you a little bit. Are you saying, are they equivalent pay?
Right, so would it be equivalent pay? For example, if I normally work 25 hours a week in your clinic, and you, instead of paying me the 25 hours a week and instead of laying me off, you put me at 0 hours a week, is it better for me as an employee for you to put me at 0 or 5 hours a week telehealth, or is it better for me to go on the unemployment rolls in that sort of situation?
Well, the unemployment takes into consideration what your income was and what your difference is, and then they make up the difference. So yes, if you could still make some of your, and they only pay 55 to 65% of your previous salary. So it could be better, yes, if you could work some of those hours at full rate and only get the 2/3 for the part you missed.
So I guess what I'm alluding to is I think you really, in my opinion, and what I've been advising clinics to do is you need to look at not only what's going to be best for you in the clinic, but sometimes what's going to be best for your employee also.
Great.
So choosing to lay somebody off is a horrible decision, and particularly in health clinics, tend to think of those employees as family members, really, really care about them. We also think about, in some cases, how gosh darn hard it was to hire them in the past. But again, we're in unprecedented times, and I think right now, making these hard decisions and really looking at dollars and cents, sometimes the choice for your practice and the employee may be laying them off.
Right. Well, and one of the things that happens is if you invoke a leave of absence, you then have a requirement to bring them back to an equivalent position at the end of the leave, and we don't know where things are going to be in 12 weeks. You can have every intention of hiring that employee back, and you can have that in place, but that's one thing to take into consideration too, is if with unemployment you do not have that requirement. One of the other things that's a possibility, for example, if you have an immune compromised employee, and their physician has said it would be better that they did not work in a healthcare environment due to that right now, they might be eligible for short-term disability, which again would be a better case scenario for the employee and the employer. So that's something to look at, those types of situations. And for those who are perhaps wanting to keep employees there, they're shorthanded, they have staff that's cross-trained and work, needs to be there. If childcare is an issue, you might consider paying childcare for that employee. That would be might be less expensive than paying them to be off on a leave where they're not getting their full pay, then you having to pay that and then find someone else for that position. So that's a thought as well. And I think we covered some of these already. Eric did with the line of credit and the SBA loans about ways to find cash flow for your company. Another one is business insurance. I know some practices have already gone to their business insurance looking for options there and have not had any success or much success, I understand. Most of it is this would be covered under business interruption insurance, and often that is not covered because it requires a personal property act, usually something that triggers a business interruption event such as a fire. But there is legislation and talk among the insurance companies about making different choices for this particular situation. So more to come there, and that might be something to be able to tap into as well.
And Debbie, since my part of the presentation, some of our participants have shared some information on the SBA loan that, first of all, the loan is direct with the SBA, and they're actually doing 2 times daily webinars right now to kind of help us out to navigate those waters. I thought that was really good information.
Yeah, that's great.
Also, Debbie, on the business insurance, I have been on the phone with many agents across the country. There are business interruption policies that are actually paying. You really need to get with your agent and make sure you have the right policy. However, as they mentioned, legislation, and I continue to preach, contact your local representatives. If the government is mandating all insurance help pay for care for this coronavirus, then they also should go to our business interruption policies. This isn't, they're claiming it's an act of God, and hopefully legislation will change that. But I urge you to continue calling your insurance companies and fighting for that benefit.
And I think that's such a valid point, Jackie. Right now, again, we are in unprecedented times. And so you may have gotten an answer from your insurance agent, but things may change. So this is the time where don't take the first answer, because something outside of their control could change the answer, such as an act of Congress. Who knew an act of Congress could overrule an act of God? at least in the insurance world. We did have Debbie, maybe you can help answer this question. Somebody asked, do all states have the same work share unemployment options?
That I honestly cannot tell you. We are in Colorado, and it would be individual unemployment offices as far as I know.
And so I'll speak to that a little bit more.
Okay.
And I think, and I'll speak to this a little bit more when we get to the tax side. I think a lot of states are really taking the lead in their response to this. We are waiting on the federal government for some responses, but states are really stepping up and taking the lead. And so the work share option that's happening in unemployment is a state choice. And so remember, unemployment is one of those jurisdictional type of taxes. So you will have to look to your particular jurisdiction to see what's going to happen. And then you can always reach out to your Eide Bailly professional as well. They would be happy to walk you through the intricacies of what's happening in your particular jurisdiction.
Most of you probably know about much of the legislation that has come out. I'm just going to briefly go over that. Shauna has some more to discuss about that later, but the Families First Coronavirus Response Act that has actually been put into effect actually combines the medical emergency medical leave act expansion and the emergency paid sick leave act. And the differences are summarily that the Family Medical Leave Expansion Act really helps cover families that need to be gone home to take care of sick family or childcare issues by childcare being closed or school being closed during this time. And so it's a job protected position. It requires some payment on the part of the employer to the employee, and then they get their positions back at the end of the term. Now, one thing under this one is that the Department of Labor has the authority to exempt businesses who are under 50 employees if this law would jeopardize their viability. So you definitely can use that if that is your case and work through that. The Emergency Paid Sick Leave Act, that is if there's a number of different reasons, they've got 6 of them identified. If it's COVID related, that they need to be out of the office, and general and employees entitled to 80 hours paid sick time. And this can be concurrent with the EFMLA as well. So if they need to take that one, they can take the 2 weeks of paid sick leave time, and that covers the first 10 days off of the EFMLA. It's not the same exemption here for the under 50, but the employers of healthcare providers and emergency responders can be exempt for those providers. So they did not make a definition of that, but it's generally interpreted as those who are actually providing medical services. Physicians, physician assistants, nurse practitioners, respiratory therapists, those kind of people who are medical assistants, those who are providing medical services, and likely it's those such as receptionists and schedulers that may not be exempted by that.
And Debbie, we don't have any details on how to apply for that Bureau of Labor exemption if you're under 50 yet, do we? I mean, this legislation's a week old.
Right, and I actually had reached out to legal counsel about that, and they said at this time it's not anything you apply for. You just need to document who's doing what, and we'll have to pay attention to any clarification about those definitions.
So I'll ask the team. One of our participants asked, if we lay off staff, do we need to end all benefits? And if we then hire that staff back, do we then re-enroll them in benefits?
Yeah, if they're laid off, they're technically not on your payroll anymore. So they could get COBRA or continuation insurance depending on their situation. So that's something they could do.
Right.
They could also go to the exchange, correct?
Mm-hmm.
Correct. And again, that's one of those jurisdictional type things where you can go to the exchange. And I'll just re-emphasize that point. A lot of the options that we're talking about right now are going to depend on your jurisdiction. So again, Debbie and I are in Colorado. In Colorado, we have ended all elective surgeries. So you cannot go to an ASC and perform what's going to be considered an elective surgery right now. And I think it depends on the health system and what's going on and what's being defined as an elective surgery. So that doesn't mean all surgeries have ended, but it does mean that definition of elective. And so again, it's going to depend on where you're located and what's happening in your particular state right now, what maybe your association has decided on. I know a lot of dental associations have recommended that the dentists completely stop practicing. And so again, it depends on your situation. Contact your Eide Bailly professional. They're happy to help you through your particular situation. We are talking in generalities right now and just trying to give you ideas on what might work in your particular state.
And Debbie, can you touch on the healthcare provider exemption? We're getting questions coming in about that.
Well, that's what there's not been clarity around. That's what I reached out to legal counsel about for definition. And at that time, they said that they felt that it meant the providers of the medical services to the patients would be included in that, but not necessarily ancillary staff.
But as far as how that applies, meaning that they could be exempted from these acts, is that the correct understanding?
Correct.
That
They don't have to be.
The employer can choose to say, we're exempting our healthcare providers from these two acts, which, to kind of put it in a nutshell, if I'm the employer, therefore I'm the physician or the dentist, then I'm really talking about my hygienist or maybe my APC of some kind. For the most part, saying that we're not going to cover them by this.
Correct.
Okay.
Just a reminder, we have 25 minutes left.
Okay.
I'll make one note about layoffs, and then we can skip through the other slides because they're just some compliance considerations that you want to keep in mind when you're looking at what you're going to do with your employees. But that is that if you're going to do layoffs, you need to look at what criteria you're going to use and have it be as fair across the board as you can, whether have it neutral and objective, whether it's going to be by length of time worked, whether it's by position, etc. And that's all for me. And so, Shauna, you are up next.
Okay, so I am going to briefly touch on the payroll tax that is going to pay for this extended sick leave and family medical leave coming up. And I apologize, I'm waiting for the screen to advance.
Did I not? Is there something I did?
No, it's Shauna. It's definitely Shauna. So I'm going to cover the Family First Coronavirus Response Act, just briefly touch on some of the tax pieces in that act, and then I'm going to go into some of the other legislation that has either passed the Treasury or is currently in Congress right now. And so Debbie touched on the Family First Coronavirus Response Act to begin with a little bit. I'm going to say in general, and some of my other panelists are welcome to interrupt me if they would like, if you can get your employees exempted from this act, from a cash flow perspective, that is going to be the best thing for your practice. And the reason why is Congress is paying for this through tax credits of Social Security tax credits. The cases that I've actually run for clients, the tax credits, the payback of those credits do not match the cash outlay to employees. So for example, the paid sick leave provisions require you to offer your normal paid sick leave, so normal PTO, and then on top of that, an additional 14 days of sick leave to the employees, and you're going to receive that back in credits. Well, if we have drastically reduced our workforce, the employees that are going to be getting these credits through our Social Security reimbursements, I'm not going to get the payback of those credits maybe for 3, 4, 5 months. And in order to match our cash outlays with the credits, we want to get people out of this as much as possible. So I will say the actual application of this depends on your particular tax situation. It is worth it to reach out to your tax professional to have them walk through examples for your clinic, your hospital, etc., if this is going to apply to you. But again, my advice, and anyone else jump in if they'd like, I would say whenever possible, try to take the exemptions to not have to fall into this particular act.
Yeah, Sean, I would concur. It's very technical. You're out a lot of cash for a while, which is exactly the opposite of what we're recommending right now.
Mm-hmm.
That you could be harming the employees you need to service the patients that you are having cash flow wise, your ability to meet their payroll, by trying to meet the payroll for these people that you might be better served having put them on unemployment.
Right. The second thing I want to talk about from a tax perspective are some of the deadlines that have been extended. So currently the IRS has extended the income tax deadline until July 15th for any federal tax payments due on April 15th. So, and then in general, for most of my clients, I'm saying that that's going to include your second quarter estimates as well. And so we're going to wait at least until July 15th to make those estimates. Now, we've had a lot of questions from our attendees, and I actually had a lot of questions beforehand as well about what about my B&O payments for Washington? What about my state income tax payments here in Colorado? What about my state income tax payments in California? So there is legislation happening actually every single day about these payments. I would recommend if you go out to the Eide Bailly website, sign up for our insights for our tax payments, and our state and local tax department is going to start sending out emails related to the extension of some of these deadlines. And so about 10 minutes before I got on this call today, I saw a preview of what's coming out this afternoon. It's going to include updates on the state of California, on the state of New York, I do think there's a Washington state update in there, a Colorado update. And what's interesting is a lot of the states are not only extending income tax payments, but what we're seeing in some states where they have the authority, some property tax payments are being extended, and some of the other forms of tax in those states are being extended. So as we're talking to people about the relief, trying to hoard as much cash as possible, preparing for this new normal, understanding which payments you have to make and which payments you can skip is going to be really, really important. And so make sure you sign up for those insights so that you're going to receive those into your email box and get the information that you need. Again, you're always welcome to email your Eide Bailly professional and they can get you that information as well. Well, the last thing I'm going to do here is look at my crystal ball, and I put off putting the slide together for as long as possible, trying to see if the Democrats and Republicans were going to decide on something together. That's what I heard about midnight last night, is that this morning they were going to tell us what was going to happen today, and as of noon, they still hadn't really told us what was going to happen. They both had really grand ideas, but no one had decided what was going to happen. I would say in general, the list that's below is included to varying degrees in both pieces of legislation. The things that vary very widely are how big the packages are, who it actually applies to. For example, the individual rebates in the GOP package, there are income limitations to those rebates. In the Democratic package, there are no income limitations to who would receive the individual rebates. The ability to have additional loans into the market under the GOP package, in most cases, those loans are required to be paid back. In the Democratic package, those loans are not required to be paid back. So I'm sorry I don't have any answers for you right now. I really, really wish I did. I have more questions than answers, just like all of you. I will recommend that you sign up. Eide Bailly is having their quarterly legislative update this Friday. Our National Tax Office will actually be handling that update, and if you log on and listen to that, if anything has been passed before then, they will be able to go through that in some really good plain language and help you to understand what's going I am, because we only have about 15 minutes more of time, and Jackie has some really good information about how to talk about telemedicine. I'm going to throw it over to you, Jackie, so you can talk about how people can actually see patients right now.
Donna, just a real question. Which loan was going to be paid back and which one's not,
So
as far as the Democrat-Republican fight?
Yeah, so right now the GOP is asking that their loans be paid back. The Democrats, their package has loans that can be forgiven. And it depends on what's going on, right? And so in the Democratic package, your loans can only be forgiven if you keep your workforce in place. Well, what does that mean? Does that mean I have 90% of what I had before the epidemic? Do I have 100% of what I had before the epidemic? How is that measured? And so we don't have those answers yet. And hopefully when we do, we can help you guys walk this through.
I think a clarifying point is they're talking about new loans, new programs that don't exist.
Correct, yes.
One of which is a loan to keep your people employed, or at least on the payroll, whether or not you're even in operation. And there are others. And obviously, we don't know which ones will actually come out, but there are all kinds of federal loans and rebates and different things that are talking about. And so part of our recommendation on conserving cash is hold on until some of these things come out of Congress. Some helps will be coming. We just don't know what they're going to look like yet, but everybody's talking about some kind of help that will help this group that we're addressing today, at least from what we can see.
Thank you. Okay, let's see what we can do to keep your patient care going and putting a little bit of money back into your pocket. But mostly quality of care and patient care should be first and foremost. So we're going to talk about telemedicine today. Where is it? Well, we're definitely in a crisis mode. But previously, according to Sullivan and Cotter in 2019, only 40% of the providers were providing telemedicine and 60% were not. And so why? Why was the barriers? Well, licensing has always been an issue, especially with cross-state payer coverage for the services. Cross-state reimbursement has been a barrier. They say lack of provider training, but from what I can see, it's more of providers not feeling that they can care for their patients as they should via telemedicine, telehealth, on the phone or etc. So, and there's some regulatory restrictions that we'll go through, one being only paid for rural. Okay, telehealth, what is telehealth? It's the apparatus, the communication technology that we're using to support telemedicine. Telemedicine actually is the practice of using the technology to offer care to our patients. Wanted to get that clarification because there does seem to be some confusion out there on the road of what is it. Thank goodness, as of March 17th, hopefully the slide will go forward. On March 17th, Trump's bill actually expanded telehealth coverage to what they're calling as a bold statement as across the country. So all hands are off, all administrative regulations have been wiped or being trying to wipe as far as barrier and at burdens, if you will. They've opened it up to almost every practitioner out there, physicians, physician assistants, nurse practitioners, psychologists, psychiatrists that have always been able to do that, but psychologists and social workers. So there's no geographical restrictions, just as of today. This is a temporary thing. Let me just clarify, temporary. But there's no restrictions where it was mostly rural. We do have some issues with the rural health clinics and federally qualified health clinics. There is some tricks with that. If you're affiliated with a critical access hospital, they actually can bill for telemedicine visits. So we'll have more on that Friday. Telemedicine is patient initiated. What that means is the patient signs up on Teledoc, wants to make an appointment, they're initiating the visit, but if they call your practice and they need to be seen and you're closed and you indicate that they have an option to see you in telemedicine or take a phone call, and they agree to that and they schedule, or you pass them right to the provider, that is verbal acceptance, and that is good to go. We have been waived from that. Medicare coinsurance and deductibles still apply to these services, but services are available in office visits, mental health, counseling, and preventative screenings.
So I just want to interject there for a minute, Jackie. In the bills right now, one of the provisions is that the coinsurance would not apply for telehealth going forward or for COVID-related activities. And then I have a question for you. So this is federal regulation. What about malpractice insurance? Does malpractice cover all telemedicine?
The malpractice follows the provider wherever they go. It's not state specific. It's more of your DEA license, your medical license. Essentially, you have to notify your carrier that you're going to be in Washington or you're going to be in Florida, those kind of things. But your med-mal insurance follows you wherever you go.
Okay, thank you.
In whatever setting.
Okay.
On March 13th, they also, they took a whole bunch of waivers off, trying to get rid of administrative burdens. So if you have a patient that needs to go to a SNF unit and the requirement was 3 days of hospitalization, that is waived now. You can send them directly to the SNF. There's some acute care hospital waivers where they had sections of the hospital that can only take inpatient. Those are expanded. Durable medical equipment that has been destroyed or damaged or unusable, you do have to document why, but those have been waived and will be paid for. You can, without a face-to-face meeting with your patient, those can be covered. There is also another enrollment requirements are waived for application and site visits. CMS expanded applications and enrollments. And what that means is it went out to the states under 1135, section 1135, and wanted to get rid of the administrative burden for pre-authorization, streamline enrollment. So if you have to go to another facility that you're not currently credentialed or enrolled in, those waivers would help you transfer from one facility to another. Unlicensed facilities could actually start seeing patients, home screenings and home health issues if you're not credentialed or accessed into that facility. Those waivers, and they're state specific. So currently now, all waivers that have been followed by the feds is Alabama, Arizona, California, Illinois, Louisiana, Mississippi, New Hampshire, New Jersey, New Mexico, North Carolina, and Virginia. I do believe there's 11. So all of them have heeded the warning and taken all those barriers off.
So Jackie, we only have about 5 minutes left. I know that you have a really good slide in here about here are kind of the basic steps that you should implement for implementing telemedicine. Can we skip to that slide and do that right now?
Yes.
Thank you.
We have some information about carriers that will be coming to you in the slide. Most carriers and payers are heeding all of CMS's regulations, and hopefully the slide will go forward. Gather your team on implementation of telemedicine. Again, if you've got a reduced, you have to have somebody helping you keep the phones answered, keep the billing going, and help service. So gather the team that you need to implement telemedicine. We'll help you with the guidelines for payment. Feel free to reach out to us. Work with your EHR vendor. They already may have a telemedicine application on. and I think you're fine. Talk to your malpractice carrier in case you do have to completely close about patient continuity and continuous of care. But I have given you a list of the best telemedicine software applications in 2020. Hopefully it'll go. Zoom for Health is free. Apple FaceTime is free. They don't integrate with your system, but you can get them up and running immediately. Now, again, notify your patient that and ask them if they'd like to do a telemedicine call or FaceTime, get that scheduled in your system. You still have to document everything as well. DoxyMe actually does interface a little bit with your EHRs. So that's another good one. Azia is promoted by Utah. I'm in Utah. Eric Nuttall and I are in Utah, and the Utah Telemedicine Association is using that one. Now, to determine your protocols and applications, again, determine when you can be available for your patient's schedule. Set up space and accommodation for the visit, whether you're at home or at the office. Ensure documentation requirements are met. Verbal consent is, acceptable, and it doesn't have to be. Now, Zoom and Skype are not HIPAA compliant, and that has been waived too. Your applications do not have to be HIPAA compliant in this temporary crisis mode. But communicate, like Eric had said, communicate with your patients that you have this option. They need us. They need prescriptions refilled. They need to understand, some bug bite. Get with them via email, text message, whichever you feel comfortable with. But for the most part, many of your appointments can be done by telemedicine. And the reimbursements, feel free to call. I have all the reimbursements. And at the end of here.
Jackie, this is Debbie. When they have to document verbal consent of the appointment, do you need to notify them that they might be on a non-HIPAA compliant EHR and they have to consent to that as well?
Yes, and I do have a free consent form that we could send to every client. As long as they notify them that it is not HIPAA compliant, the doctor can actually write on the consent form verbal consent and the date, scan that into the EHR. It doesn't have to be viewed by the patient, but it is recommended that you do make sure that they're aware of that. Thank you.
Jackie, doesn't Zoom have a paid version or a Zoom Health version that is HIPAA compliant?
I do believe they do.
I believe they do. The free version isn't normally HIPAA compliant. It's waived at the moment, but I think that the paid version is.
And
we're seeing those comments as well.
And some of the doctors that are struggling, when they go from, and I don't know if you can help me, Amy, but the slides are not advancing. There we go. So I've talked to some of the doctors out there, and they don't want to put a lot of money in this. They're only going to use telemedicine for a short time during this crisis to take care of some of their patients. They don't want to invest a lot. So, depending on what the fees are on a monthly basis, if it's $30 a month, maybe that's not too bad. If it's $25, $50 per provider, then that may be another issue. So to check with them on the cost.
So sorry to cut you off, Jackie. We're actually at the top of the hour, and just to honor everyone's time, I'm actually going to stop you right there. I am going to say, though, Jackie's slides are absolutely incredible. Amy, who is hosting us for us today, is going to be sending out the slides to all of the participants today. So long as you entered your email information, you are going to receive those slides from Amy. And to my point, Jackie's CPT codes, she has information in here about telemedicine, seeing somebody in video, just having a voice telemedicine. So all of that is covered in Jackie's slides. And then she's also available to you. Our contact information is going to be in the slides also. So please reach out to any of us as professionals, and we're happy to answer your questions to the best of our ability.
One last thing, MIPS. The deadline is the 31st. It has been extended to April 30th. If you've already filed your MIPS, please contact your Eide Bailly advisor. Otherwise, if you have not, the deadline is April 30th. And if you don't happen to submit your MIPS by April 30th, due to the extreme and uncontrolled circumstances, you will receive a neutral payment adjustment in 2021.
Thank you, Jackie. That's great. I think the final thing I want to say today, could you advance the slide once more, Amy? We do have 2 other webinars coming up at the end of the week, which I think both of us did mention. There is the quarterly legislative update on Friday, March 27th, and then immediately after, the healthcare industry town hall discussion is going to be happening. I believe, Jackie, you're presenting Friday again, correct? You'll be on that call, and some of our other healthcare leaders will be on that call. And so as changes happen, Eide Bailly is here for you. So you are welcome to register for either of those webinars. And then if you go back one slide, Amy, I did mention before that please subscribe to our newsletters. We are working very, very diligently and releasing information as quickly as we can. So if you go to eidebailly.com and follow the instructions on your screen, you can get those newsletters in your inbox. We're releasing up to 1 to 2 a day. I'm really, really proud of our team and what they're doing. And I just want to echo what Eric said at the beginning of this call. We are Eide Bailly professionals, and we help physicians because we really, really believe in healthcare, and we really, really believe in patient care and the health of patients. And we believe that the health of our clinics and the health of our physicians, their financial health, directly relates to patient health. So thank you again for all that you do. Thank you for taking care of our patient populations, and let us know if you have any questions going forward.